the best advice is that it takes a team, and each one of us has to have a consistency of message.
My name is Mark, and we are here for Beating the Odds Conference Conversations, and I'm so honored and so grateful to being able to interview Dr. Elizabeth Swiggum. Elizabeth Swiggum is an accomplished heart failure and cardiac rehab cardiologist in Victoria, BC, clinical associate professor at UBC with a passion and specialty for delivering quality patient-centered care in cardiac rehab. Liz, thank you so much for being here.
Thanks for.
Do you mind if I call you Liz? Is that
Please,
okay?
call me Liz.
Thank you.
Thanks for having me. This is great to have a good conference chat with you.
Thank you. I mean, you have experience with Cardiac Services BC. You have experience with Canadian Heart Failure Society, worked with the Canadian Cardiovascular Society, always up on innovation development, engaged in practice as well. What are some of the key things or themes that you're seeing now that are advancing care in cardiology?
When we're looking at advancing care in cardiology, we have to look at the full continuum. Yeah. And I would say that the highlights of the advancements are looking at how do we diagnose earlier, for that real prevention lens. Okay. The medical optimization, the importance of the entire team is really being uplifted. Yeah. Having the patient, the family, or caregiver as part of that team, really uplifted. The importance of these types of opportunities to have that message. All of the devices, all of the procedural-based care that may be needed is highlighted and educated. And then importantly, the full journey of recovery, which includes cardiac rehabilitation. And that's where I think we need to focus our attention on and invest in more.
Okay. Thank you for that. I mean, there's a lot in there, and I'm going to touch on 3 points. First, on the prevention side. We know the challenges of heart failure across the country. Over 800,000 people diagnosed, 100,000 new diagnoses every year. But there still seems to be that limited awareness around heart failure. What do you attribute that to?
Sometimes it's a difficult diagnosis.
Yeah, okay.
And so we hear that most people get diagnosed in the emergency department. Yeah. Unfortunately. So what's our opportunity? We can use electronic medical record, using AI technology to look at those key indicators of risk, to then intervene, not just measure, but intervene and prevent. Yeah. And importantly, about 20% of the population across Canada has no family physician or other primary care provider. So without addressing the population health needs, we're not changing that statistic of the diagnosis.
I remember a conversation we had, one of the first conversations when we met, and you were talking about a patient that was waiting to see you as a referral to a specialist, but passed away before they got to see you. And, and over the years, as we've grown as an organization, we've learned a lot more about that multidisciplinary care team, the importance of that. You specifically mentioned family practice. How can we engage family practice to support the diagnosis and awareness and management of heart failure?
Yeah, there's some real champions in this area. And the breadth that a family practitioner needs to understand to recognize. So how do we improve the support tools that takes away some of the cognitive load of having to know everything, to have to recognize everything? And what are some of the tools that we can use? I think that we as clinicians who are in this all the time, we come to conferences and we share our knowledge and our wisdom. And I've learned several things over the past day and a half at this conference from the experts from across Canada and internationally. And I've learned, and we need to share that learning and create a culture of learning and a culture where it's okay to ask questions and really have that collegial relationship with the other care providers so that they don't feel like they can't ask, how can I improve my skills at diagnosis? And then use the other tools and the technologies, and perhaps there's an opportunity for integrating the information with different electronic medical records. And also, what's the opportunity for AI, as we heard yesterday, for looking at all of the parts of a patient's journey that then comes to a diagnosis, and allowing the physicians in Canada to use those tools.
I mean, great perspective, and you're exactly right. Conferences like this bring bold ideas. It's innovations that we're able to share. You can take back to your practice as patient partners. We can share. I think British Columbia, Canada as a whole, Canadian Heart Failure Society has done a great job of integrating the patient voice into these conferences. So, what do you think the value is to integrate that patient voice across their own journey, but then in healthcare in general?
Yeah, and it's not just the patient; it's the whole family, because sometimes it's the strongest advocate within that cohort is the family member who's supporting a patient. And patients come from all levels of understanding and awareness, and so we have to be advocates for our patients, but we also have to strengthen the advocacy voice of our patients. And I think that if you're looking at system-based care change, it's really the patients who have been the most successful at increasing the awareness towards a specific medical concern. So if we look at the success that British Columbia had with longitudinal family practice, where there was an investment in family doctors, it was the patients who said, we all need a family physician. Everyone deserves a family physician. And the same should be true for everyone deserves the specialist when they need it. Not waiting, not having that heartbreaking situation where they're waiting to see the specialist, because many diseases are so complicated, you need a team, and the team often includes at least some opportunity for a specialist to weigh in. And so I think that we can learn a lot from what success has happened and really leverage that as we move forward.
And you played a big part of that, especially on the family practice side, and even still advocating for access to specialists, but ensuring that specialists then are being recognized for the work that they're doing as well. And you talked about system-based change, and I mean, I'd be remiss if we didn't talk about cardiac rehab. Within our system, there's challenges for patient access to cardiac rehab, but we know the importance of it. So it would be great to hear your perspective on why cardiac rehab is so important for patients throughout their journey, but B, what can we do then from a system perspective to ensure that access is there, and then we can provide broader support for individuals living with heart failure.
So just to describe what cardiac rehab is.
Please.
Cardiac rehab is essentially a multidisciplinary opportunity to improve risk, improve function, improve confidence, improve mental health. It's a team sport. So there's nurses, physicians, physiotherapists, exercise specialists, and in some places they have a dietitian involved. In some places they have a social worker or a psychiatry supporting all the social determinants of health and mental health as well. The full person. And so that's the cardiac rehab success. And a lot of the research for cardiac rehab has been focused on coronary artery disease with a significant reduction in cardiovascular mortality, total mortality, but really importantly, the reduction in hospitalization. So when we're looking at a cost-benefit ratio, we can see true improvement. Smaller studies, though, and so when you look at the totality of the information, you can see risk reduction for all of the diseases that lead to heart failure. You can see mental health improvements. You can see functional improvements. You can see that cardiac rehab in the elderly is also important for frail elderly patients with heart failure. And so there's lots of evidence. Now, so what do? Well, we look at all the risk factors and make sure that the medical therapy is okay, support the other determinants of health, and also the exercise portion is important. And we heard yesterday that exercise is medicine, and we have improvements in outcomes, and so we want to also highlight that. Now, why is it difficult? It's because historically it's a facility-based approach, and when you're looking at opportunities, I think you have to say, okay, we learned a lot through our virtual care shift that happened a few years ago. How can we deliver cardiac rehab differently? Perhaps it's facility-based, perhaps it's virtual, perhaps it's a hybrid option. And we're trying to then come back to the patient and say, hey, this is the menu that we have to offer you. What can we do to help? How can we help? Not make it difficult, not make it onerous. And it's funded in some places in Canada, it's not funded in others. And I think that individuals may want to invest in themselves and be able to do that,
yep.
but not everyone's able to do that.
Yep.
So from a system-based, how can we support the patient? That's the difficult one because it's so fragmented.
It is.
Within a province
Yep.
and nationally.
And nationally, yeah. And I mean, you make a good point, though. It's going to the patients, going to where they are to ensure that they can have the support where they are when they need it, versus having the patient then maybe having to come from rural or remote British Columbia to a major center for a 2-hour cardiac rehab course when it takes them 6 hours to get there. That's not going to create adherence, right?
No.
So it's being able to have those conversations with patient partners, caregivers, to understand their needs. And I mean, you're one person that does a great job of doing that. So thank you for that. Given your experience, across the heart failure space in systems care, what's a piece of advice that you could give to your colleagues in the heart failure space to better support their patients and caregivers in their journey?
Having the conversation with patients about all of the different elements takes time.
Yeah.
So, I would say that the best advice is that it takes a team, and each one of us has to have a consistency of message.
Mm-hmm.
And coming back to what you started with, like, how do we share our knowledge and how do we improve access and equity? It really does start with increasing the playing field so that everyone has the same message. And I think you'll hear that a lot when you're talking about the cardiometabolic, kidney disease realm, where we're all speaking the same language.
Yeah.
And when we're all speaking the same language, and we include in terms of the 4 pillars for heart failure with reduced ejection fraction, really making a foundation of the other elements of benefit, like cardiac rehab, but having the same message, and engaging the patients in ways that allow them to ask the questions like, I haven't been prescribed this, why haven't I? So making it transparent and visible so that people know what's out there, so that they know that they can advocate for themselves.
Amazing. So, we talked a lot about knowledge sharing, heart failure as being a team sport, but also then looking at that full person, right? And ensuring that we know the goals and objectives of the person, their lifestyle, having those right conversations. And I think that's the basis for care for individuals. And you are a big part of that team. And we thank you so much, Dr. Elizabeth Swiggum, for everything that you do for not only patients and caregivers across the country, but the way care is going to be delivered in the future. You really are making a difference, and we really do appreciate it. Thank you so much for another bold conversation. Stay tuned for more coming up soon.